Depression is a characteristic unhappiness, loss of interests, energy and appetite, difficulty in concentration, and restless agitation. Unipolar depression can occur without any apparent stress prior to episode, and it afflicts 13 to 20% of the population at any time. It can be lethal due to its connection to suicide. 80% of suicide victims are profoundly depressed, and suicides appear to be impulsive acts. Inheritance of depression is concordant for monozygotic twins, 60%, and is significantly higher than dizygotic twins, which is 20%. Concordance for monozygotic twins remains high whether they are reared together or apart. Adoption studies show that there are higher rates of depression among the biological parents of depressed patients rather than the foster parents. The brain changes with depression. Blood flow, PET scans show increased blood flow, suggesting higher activity in the prefrontal cortex and the amygdala compared to controls. Blood flow decreases in the parietal and posterior temporal cortex and in the anterior cingulate, which are systems incorporated in attention. Increased blood flow to the amygdala, which mediates fear, persists even after depression alleviates over time. Descendants of people with severe depression have a thinner cortex across the right hemisphere, possibly making them more susceptible to depression. Hippocampus volume is reduced, and there is less hippocampal activity during memory tasks. Treatments include electroconvulsive therapy, which is the intentional induction of a large-scale seizure. This could rapidly reverse depression and is an effective treatment for severe drug-resistant depression. It works by reducing functional connectivity between the prefrontal cortex and other cortical regions. Transcranial magnetic stimulation is being explored as a treatment for depression by altering cortical electrical activity, but has proven less effective than ECT. The monoamine hypothesis suggests that depression is caused by reduced activity of one or more monoamine transmitters such as serotonin. Antidepressants are inhibitors of monoamine oxidase, MOA, which is an enzyme that inactivates the monoamines, norepinephrine, dopamine, and serotonin. Reserpine reduces norepinephrine and serotonin release in the brain, and this can cause depression. Second-generation antidepressants called tricyclics conform to the monoamine hypothesis because they inhibit the reuptake of monoamines by boosting synaptic activity. A modern class of antidepressants is the selective serotonin reuptake inhibitors, SSRIs, such as Prozac. SSRIs are more effective than MOA and tricyclics with fewer side effects. They increase neurogenesis in the hippocampus, which may mediate mood effects of the drugs, and it also increases production of brain steroids such as allopregnanolone, which stimulates GABA receptors and reduces anxiety by contributing to the effectiveness of SSRIs. SSRI drugs increase synaptic serotonin within hours of administration, but usually take weeks for it to take full effect and make people feel better. This suggests it is the brain's response to increased synaptic serotonin that relieves the symptoms. In placebo-controlled trials, 1/3 of the people taking the placebo also felt better, suggesting that some people helped by SSRI treatment were benefiting from a placebo effect. Only people with severe cases of depression respond significantly better to SSRI treatment than to placebos. Some over-the-counter drugs may react with the drugs to push synaptic serotonin levels too high, triggering serotonin syndrome. This is a syndrome of confusion, muscle spasms, and fever. Another treatment includes vagal nerve stimulation, where electrodes are wrapped around the vagus nerve and a pacemaker provides mild electrical stimulation at intervals. Little evidence is shown that it actually works. Deep brain stimulation is the mild electrical stimulation of brain sites through a surgically implanted electrode. And cognitive behavioral therapy is a form of psychotherapy aimed at correcting negative thinking, reducing stress, and improving interpersonal relationships. It is as effective as SSRI treatment, and the rate of relapse is lower. CBT and SSRI treatment together are more effective in combating depression than either one is alone. Hypothalamic pituitary adrenal axis, Cushing's syndrome, is when people have very high levels of circulating glucocorticoids, such as cortisol, leading to a person becoming more inclined towards depression. Suicide victims and hospitalized patients with depression show very high levels of circulating cortisol, this suggests that adrenocorticotropic hormone, ACTH, is released in excessive amounts by the anterior pituitary. The dexamethasone suppression test is a standard method for assessing hypothalamic pituitary adrenal function and its tendency to release excess cortisol. Synthetic glucocorticoid originally suppresses early morning rise in ACTH that is typical in most people. This fools the hypothalamus to thinking that there is a high level of cortisol. More females suffer than men from depression. Women are twice as likely to suffer from depression as men. This expresses patterns of help seeking by males and females. Women use health facilities more than men do. Clinical depression is related to events in the female reproductive system, and postpartum depression is a bout of depression either immediately preceding or following childbirth, which suggests that some combination of hormones can precipitate depression. About 1 out of every 7 pregnant women will show signs of depression. Sleep characteristics change in affective disorders. Difficulty falling asleep and inability to maintain sleep are common in depression. Sleep in people with depression show a marked reduction in stage 3 of slow wave sleep and increases in stages 1 and 2. Patients with depression enter REM sleep much sooner after sleep onset. The latency of REM sleep correlates with the severity of depression. The temporal distribution of REM sleep is altered, and there is an increased amount of REM sleep occurring during the first half of sleep. Animal models of depression. Learned helplessness is a type of stress model where an animal is exposed to a repetitive, stressful stimulus, example, electrical shock, that it cannot escape. This is linked to decreased serotonin and dopamine function. Another model is removing the olfactory bulb from rodents, causing an animal to display irritability, preferences to alcohol, and elevated levels of corticosteroid, which can be reversed by antidepressants.